who is a researcher at Ca' Foscari, who is going to speak to us about human rights and the World Health Organization and how this functions in the time of global emergency, as we have obviously right now facing us. And I think that actually, especially given Donald Trump's declaration today that he was going to suspend, for example, funding to the World Health Organization, um, the I think this is exactly the time to be talking about the issues of democracy, of human rights, and of global governance in this time when we really need, obviously, to have a very clear idea of where rights and responsibilities lie and how this all folds together on the global scale. So I want to thank you, Sarah, for being the first webinar of this series for Science Gallery Venice. And thanks to everybody also for showing up today. And I will turn it over to you, Sarah.
Thank you very much, and good afternoon to everyone. Thank you very much, Director Artman, for hosting me, and thank you, Erika Villa, for organizing and planning this. It is really a great pleasure to talk to you today about this topic. And as you suggested, Neil, exactly, it is particularly timely these days. So because the pandemic we are facing raises numerous concerns and also questions from the point of view of human rights law. And this is precisely my angle of today. And it is timely in a period in which the United States decided to halt funds to the World Health Organization. If implemented, this decision would jeopardize the international action, and we do need international cooperation to face this crisis to counter the pandemic. As you might know, the World Health Organization was founded in 1946 as a consequence of several conferences, health conferences in the previous years. The idea of the talk of today is to start from the World Health Organization and the Declaration of Pandemics, which um, are in the mandate of the organization, then move to the restrictions to human rights in times of emergency, whether and to what extent human rights can be limited in times of emergency. And finally, I would like to provide some reflections on what I will call the intersectional impact of the measures adopted to face this emergency. So starting from the World Health Organization, we can say that the constitution of the World Health Organization came into force on the 7th of April of 1948. And it contains, among others, some very important principles that must be kept in mind while talking about pandemics and the situation we are experiencing these days. First of all, health is a state of complete physical, mental, and social well being, and not merely the absence of disease or infirmity. It is interesting to note that the World Health Organization Constitution does not mention the right to health, but considers health as a state of well being. Secondly, another interesting aspect is the enjoyment of what is called the highest attainable standard of health, which is a fundamental right of every human being without distinction of race, religion, political belief, economic, or social condition. And the principle of no discrimination would be fundamental for what I will tell you in a while. And then another part that is interesting and I would like to stress is that the Constitution stresses that the health of all peoples is fundamental to the attainment of peace and security and is dependent on the fullest cooperation of individuals and states. This is particularly relevant these days. So the fact that health is a issue of human security, of peace, and it is dependent on the full cooperation of individuals and states. The World Health Organization can decide measures to contain the epidemics. It has a system of measures, of adoption of measures that are binding on states, so they create legal obligations, including, and these are very important, the international health regulations. These regulations were updated recently in 2005, broadening the system of state surveillance and notification for infectious diseases. It means that states are obliged to notify the existence of diseases. The World Health Organization has also the power to define what is called a public health emergency of international concern, which is an extraordinary event determined to constitute a public health risk to other states through the international spread of disease and to potentially require a coordinated international response. And it is the case of the COVID-19. Indeed, on the 30th of January 2020, the Director General of the World Health Organization declared the coronavirus disease outbreak a public health emergency of international concerns. There have been some critics on this determination because though it is not the topic of today's talk, it is actually worth mentioning that also when it comes to determine the responsibilities of the level of diffusion of the pandemics, the critics that have been raised. For example, according to some scholars, the determination of when a given disease constitutes an international emergency is a decision informed either explicitly or implicitly by a determination of the worth, utility, and importance of the populations impacted and their proximity to Western interest. Some scholars mention, as example, Ebola epidemics, which was announced quite late, has done a huge work to coordinate international efforts in countering the pandemic. The declaration of a public health emergency of international concern leads to the adoption of temporary recommendations to contain the emergency. The emergency committee met in July. They adopted recommendations, and these recommendations have never been updated after the 30th of January. For example, among the recommendations, there was not the recommendation of stopping the freedom of movement, for example. On the 11th of March, as we all know, the World Health Organization declared the COVID-19 emergency as a pandemic. And the World Health Organization director declared that if countries, I quote, detect, test, treat, isolate, trace, and mobilize their people in the response, those with a handful of cases can prevent those cases become clusters and those clusters becoming community transmissions, end quote. The International Health Regulation provides for technical cooperation and logistic support, early warning and notification of the spread of a disease, and elaborates a series of measures to guide preparedness and response. Most states were not ready to a possible disease. That, I'm afraid to say so, but was foreseen years ago. The World Health Organization has recently issued a specific plan for the COVID-19, which offers guidelines on the response. However, as it happened for the Ebola, which was declared as an unprecedented extent as a threat to international peace and security in 2014, the coordination of the measures at the multilateral level has not been sufficient to contain the disease. A lot depends, of course, and we could see it clearly, on the capacity to guarantee public health in the territory. And despite the huge efforts of the World Health Organization, which have always kept an eye on middle and low income countries to provide support, The World Health Organization also coordinates the donations from private funds. And as all international organizations, it encounters difficulties in the management of the daily activities without, however, missing the important scope of its action. If states want to blame the World Health Organization, well, they can do that. But they should also respond to their inertia to guidelines and researches that have been prepared over the years. As early as 2005, for example, the World Health Organization prepared a checklist for influenza pandemic preparedness planning, where social distancing and quarantines were envisaged. 2005, and this checklist has been then repeatedly updated. Now we have the specific response to the COVID-19, but there were general guidelines already in 2005. And also in terms of inertia, it can be also, but it's not the topic of today. We can also focus on the violation of environmental law and the protection of biodiversity, which might be connected also to the diffusion of the pandemic. Um, the second part of my talk concerns the human rights in times of emergency, which is very legal topic from the point of view of the legal instruments of protection of human rights. Well, in this scenario that I've been briefly depicted, it is adamant that states have the obligation to guarantee the right to health, which is enshrined in a very important legal instrument called the International Covenant on Economic, Social, and Cultural Rights. This covenant is a treaty binding the almost all states in the world, and it was adopted in 1966. At its Article 12, this covenant provides the right to health, which is conceived as the right of everyone to the enjoyment of the highest attainable standard of physical and mental health. And the steps that, according to these legal instruments, must be taken by the states in order to ensure the enjoyment of this right are several. For example, the prevention, treatment, and control of epidemic, endemic, occupational, and other diseases. So it is clearly included in the text of the Covenant on Economic, Social, and Cultural Rights. And this article has been interpreted by the United Nations Committee on Economic, Social, and Cultural Rights as contemplating an obligation for all states to assure to all medical services and medical attention in the event of sickness. The extent and the capacity of states in that respect, so in granting the full enjoyment of the right to health, cannot be dealt in detail today. But it is worth stressing that the United Nations Human Rights Committee, which is very similar to the Committee on Economic, Social, and Cultural Rights, so it's a group of experts that are appointed at the international level. So the United Nations Human Rights Committee, in two famous general comments, these are documents to interpret the rights of legal instruments, in two famous general comments on the right to life, mentioned on one hand the elimination of pandemics among the obligations states must abide by, and stressed in the most recent one that states must guarantee emergency health services and emergency health response. Another interpretation that was provided by the Committee on Economic, Social, and Cultural Rights said that although the duty to ensure the right to health is one of progressive realization, so it means that states must take steps in order to guarantee the full implementation and the full enjoyment of the right, it presupposes, according to the committee, at the very least, an obligation to behave proactively and to put in place an effective system of urgent medical care which could cope with life threatening situations such as an epidemic of the proportions we are experiencing now. So the fact that the Committee on Economic, Social and Cultural Rights clearly stresses the fact that states, no matter the situation in the country, must guarantee urgent medical care in order to cope with life-threatening situation is something that we should really keep clearly in mind. Because it means that states have an obligation to control diseases, both individually and also, and most importantly, through international cooperation, by acting in order to, for example, make available relevant technologies, using epidemiological surveillance or data collection, implementation of immunization programs, and other strategies. But can human rights be limited by measures that are adopted in order to grant the right to health of the population? Well, if human rights are not absolute, they can be derogated. And the derogation is a reflection on whether and to what extent human rights can be limited. However, it could be said that the core content of human rights must always be ensured. It is clear that containment, quarantine, travel limitations, closure of schools, and other measures have all proved to be necessary to block the contagion. However, one should not forget two aspects: that human rights can be legitimately limited provided that some requirements are fulfilled, including the principle of proportionality, and secondly, that the impact of both the pandemics and the measures adopted to counter the pandemic can be described as intersectional, reflecting both global inequalities and structural inequalities within a state. The threat to human rights by the measures adopted in response to the pandemic has been highlighted by several scholars and international organizations. For example, the United Nations High Commissioner for Human Rights, Michelle Bachelet, on the 6th of March, said that it is essential that governments introducing measures to impede the spread of the COVID-19 undertake a range, he said, of additional actions to reduce the potentially negative impact such measures may have on people's lives. So, a balancing of rights. And the World Health Organization Director General also contended that all countries must strike a fine balance between protecting health, minimizing economic and social disruption, and respecting human rights. And I can mention several others declarations of the same content. It should be stressed also that we have rights, but also duties that consist in respecting the so called duties of solidarity. And the fact that we have human rights, but also duties in human rights law is stressed by the American Declaration of Human Rights of 1948, which was adopted at the very beginning of the activities of the Organization of American States. In the preamble of the American Declaration, it is written that the fulfillment of duty by each individual is a prerequisite to the rights of all. So, rights and duties. But let us now see how human rights can be limited in times of emergency. At United Nations level, the International Covenant on Civil and Political Rights contemplates a precise system of notification of derogation to human rights, not to all human rights, only the ones that can be derogated. So, for example, the prohibition of torture can never be derogated. But other rights can be derogated, and states can notify the willingness of derogating to those rights to the Secretary General of the United Nations. Some states have submitted their request for derogation. The International Covenant on Economic, Social, and Cultural Rights does not have a similar mechanism. However, it has an article that allows limitations to the economic, social, and cultural rights, provided that these limitations are determined by law, they are compatible with the other rights included in the covenant, and they pursue the promotion of the general welfare in a democratic society. The minimum core of human rights can never be derogated. The European Court Convention on Human Rights, which is the only one I will mention today, but there is also the American Convention on Human Rights that provides for a similar mechanism. The European Convention on Human Rights has a similar system of derogation, and it is the famous Article 15. I'm saying famous because it was mentioned sometimes in the news, because Italy has never triggered this article on derogation of the European Convention on Human Rights. And as of today, 9 states have already asked for derogation. Again, derogation not of all rights, but only of the rights that can be derogated. So again, the prohibition of torture, the prohibition of slavery can never be derogated, even in times of public emergency. Is this derogation compulsory or not in times of pandemics? Well, this is a debate that scholars have. For sure, we can say that with the positive effect of having this declaration in which states admit to derogate the rights of the convention is positive to check the terms of necessity, proportionality, the temporality of the measures. Because measures that derogate human rights can, of course, be adopted for those rights that can be derogated, but they must be proportionate and temporary. The exceptionality of the situation, though not completely unforeseen, requires exceptional measures, which, however, cannot forget the impact on fundamental human rights. Examples of dubious, if not patently, measures beyond the limits are numerous, as it is the use of the freedom of assembly to adopt laws that cause a restriction of some categories of individual rights. But the core content of the rights cannot be affected. Then there is a question that I not have time to answer now, because I will dedicate my final minutes on the intersectional impact of the measures adopted in times of emergency. The question is, what if a state violates those boundaries between what is a possible derogation admitted in human rights law and what goes beyond the limits of this derogation? And the legal mechanisms that exist at the international level are probably not enough to respond to the questions on the legitimacy of the measures adopted that would be raised, in particular after the emergency. And finally, talking about limitations and measures that affect human rights, we should be aware of the intersectional impact of the measures that have been adopted so far. Intersectional approaches recognize that the forms of discrimination occur at the intersection between several systems of oppression. And it can include poverty, age, social status, gender, ethnicity, geographical position. Look at the research that considered, for example, the highest impact of death in highly polluted areas, health condition. So the intersectionality combines all these grounds of discrimination and allows us to better grasp the effects not only of the pandemic in itself, but also of the measures that have been adopted in response to the emergency. Because it is true that it is common, and you can read it in the newspapers, it is common to read that the virus eats everyone independently of origin or status. This is partially true. Not only the effects of the pandemic are worse in countries where the health system is not sufficiently equipped in normal times, not only it is worse for those who are poor, also the measures, legitimate that they might be, adopted in response to the COVID-19 might have intersectional effects. And I will propose two examples. The first one is with regard to women. Women seems to be, according to the data that we have, less affected by the pandemic. So why should we talk about women? As said by the United Nations Secretary General some days ago, peace is not just the absence of war. Many women under lockdown for COVID-19 face violence where they should be safest, in their own homes. And the Secretary General added that today, I quote, I appeal for peace in homes around the world. I urge all governments to put women's safety first as they respond to the pandemic. And we can see actually that domestic violence, but also revenge porn, sexist language have increased as a consequence of the lockdown. So we have data from China, uh, according to which the epidemic has had showed that there has been an increase in the number of women that asked help to the centers to protect women from violence. And also, end of March, there was a declaration of the Minister of Tunisia for Women Affairs raising the alarm on rising domestic violence. So there are several examples that can be made. Conventions such as the Council of Europe Convention on Preventing Violence Against Women and Domestic Violence are applicable also in times of emergency. There is no derogation to that, and states have legal obligations in that respect and will respond for not preventing and suppressing gender-based violence against women. But surely the situation of emergency can be invoked to limit um, the human rights, as we said, but to what extent? Which will be the responsibilities of states in times of emergency for not preventing, for not taking actions, or for postponing actions to counter domestic violence? Well, in my understanding, a situation of emergency cannot be used as a justification to limit the core content of women's rights, including the right to be free from violence. And this right requires a precise action of state. The emergency cannot also be used to limit the access to reproductive services, as it has happened in some countries, which, owing to the emergencies, have closed health services clinic. As for the girls, there is a matter of education and gender gap. The gender gap is increasing as a consequence of the emergency, and these data were also available for the Ebola emergency. Several studies that were conducted during the Ebola emergency found that the closure of schools increased girls' vulnerability to physical and sexual abuse, both by their peers and by old men, as girls were often at home alone and unsupervised. And these are data that were available for the emergency of Ebola, but they will be and they are actually confirmed. The gender gap, at least by UNESCO, was confirmed some days ago. There will be similar data for the COVID-19. And the second group, and I conclude with this, the refugees. On the 11th of March, the United Nations High Commissioner for Refugee launched an appeal for millions, 33 million to be precise, to help the High Commissioner to protect vulnerable refugees and displaced people from the COVID-19. And the United Nations High Commissioner for Refugees said that there were no evidence of infections among refugees and asylum seekers, but that was the 11th of March. Then there have been cases in some centers for refugees. And that he said also that ensuring the most marginalized members of community have full access to health services is the best way to protect us all. The International Organization of Migration and along with the United Nations Commissioner for Refugees on March the 10th announced that resettlement travel for refugees would have been temporarily suspended, and that at the same time there could be cases of refoulement, so to push back refugees or asylum seekers to their countries of origins, where they might risk persecution. Search and rescue operations in the central Mediterranean have been suspended, and the few search and rescue operations conducted before the COVID-19 nationwide caused led to quarantines for migrants in the reception center. The detention of migrants pending their repatriation is also a concern. The Human Rights Commissioner, by this time of the Council of Europe, was calling on all Council of Europe member states to review the situation of rejected asylum seekers and irregular migrants in immigration detention and to release them to the maximum extent possible. And also, she said that the authorities of member states should also refrain from issuing new detention orders to persons who are unlikely to be removed in the near future. Also, the closing of ports using the justification of the COVID-19 can be subject to scrutiny from an international human rights law perspective. We should remember that the principle of non-refoulement, so not to send back people where there is a risk of torture or inhuman or degrading treatment, is not only a human right, but it is a fundamental human right that cannot be derogated. And on this, we should really reflect a lot. And along with this, we should reflect on the condition in the camps where migrants are held, overcrowded conditions without access to basic sanitation. So to conclude, there are several challenges that come from this emergency. Human rights law should be at the core of our reflection. Of course, it is necessary to limit certain rights. This is undeniable. But this must not be taken as an excuse for further and, most importantly, permanent violations of human rights. What the emergency, as to my point of view, highlighted is the international impact of the pandemic. And those who are at the intersection of different systems of oppression will be the one to suffer the most.